A 54-year-old female is not having a great day. She went to her dentist for an extraction, and 3 hours later, the tooth is still there. Check out the case today on the Open Reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today we're helping improve a rough situation. This patient is a 54-year-old female who originally went to a different practitioner for extraction of a left maxillary first molar, tooth number 14. The tooth had a crown and recurrent caries and was deemed unrestorable. This patient is otherwise healthy with no allergies. Unfortunately, things did not go well. This patient was in the chair for over 3 hours while this practitioner tried to remove this tooth. That's right, 3 hours. This is a bad day for everyone. It's absolutely miserable for the patient, and it's stressful for the provider too. The patient was eventually discharged from the office with antibiotics and told to seek out an oral surgeon. She eventually found me and called my office. It took her a couple days to find me, and in this time she's been in excruciating pain and unable to eat. I took a look and instantly saw why she had a high level of discomfort. The adjacent soft tissue is traumatized and it's mildly bleeding. There's still a large amount of tooth structure left at this site. Tooth number 13 has a defect in the crown. The first thing I absolutely always do whenever I'm a secondary provider is get a fresh x-ray so that I have a documented starting point. Next, I give her local anesthesia, which gives her instant relief. I remove necrotic mucosa and granulation tissue. This is a maxillary first molar, which typically has 3 roots that go off in different directions. The 2 buccal roots are smaller than the palatal root. I frequently section these roots and remove them individually to minimize the trauma to the adjacent bone, to preserve the buccal plate, and to prep for a future implant. I section these roots with a handpiece. This creates a purchase point and allows me to remove each root individually. I then use an elevator and the roots start to move. I remove the 3 roots individually. I'm happy to see the buccal wall is still intact. I rinse and examine it closely to look for a sinus communication. I don't see the sinus, and I'm able to feel with the curette that there is bone at the superior aspect of this extraction socket. Finally, I close the site. This patient recovered well from this, but she was very unhappy. There's a few lessons in this case, but the biggest one is how important it is to have a referral or a plan of action when a complication occurs. The worst thing to do is put the onus on the patient to seek out help after a complication. Thanks so much for watching. Please click those like and subscribe buttons and check out the channel for all kinds of interesting OMFS cases like this one. Also, keep an eye on my website, theopenreduction.com, for advanced surgical skills. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.